Hey everybody, Dr. Jeff Williams with Creekstone Integrated Care right here in beautiful Amarillo, Texas, coming to you with another blog, another idea this week. This week it's called, Do I Need to Get X-Rays When I Go to a Chiropractor? Here's some new thinking around chiropractic imaging, okay? For generations, it's been well recognized that chiropractors take X-rays. In fact, chiropractors are trained to read X-rays in school at a level that generally no general family doctor, medical doctor is taught how to do. You're just fresh out of school, you'd much rather have a chiropractor read your spinal X-rays than anybody else that's below a radiologist. In some cases, chiropractors really take a lot of X-rays. However, as with anything else in healthcare, as more is learned through research, common practices are often reassessed and they're updated when necessary. And taking X-rays is a prime example of this, as the thought process around imaging, it's currently being cussed and discussed at the highest levels of not only the chiropractic profession, but the medical profession. Basically, as it seems to be with just about everything in the chiropractic profession, there are two camps. One supports the use of X-rays to determine safety of treatment, the type of treatment, and then shooting several X-rays periodically throughout the treatment to kind of validate the treatment effectiveness in their system. On the other end of the spectrum, you have chiropractors like me that are on board with the newer research, the newer evidence, and updated recommendations and guidelines. One of the largest uproars in the profession came about approximately 3 years ago, somewhere around 2017, when the largest chiropractic organization in America, the American Chiropractic Association, also known as the ACA, presented their recommendation program called Choosing Wisely. Basically, the ACA said to avoid routine spinal imaging in the absence of clear clinical indicators for patients with acute low back pain of fewer than 6 weeks duration. So they've been hurting less than 6 weeks. If you're going to get X-rays on those folks, you need to have very clear clinical indicators. And according to the ACA, clear indicators were conditions like history of cancer, fracture or suspected fracture, progressive neurological symptoms, and infection. Not to mention other complicating factors like osteopenia, osteoporosis, and tumors. They argue that unnecessary imaging means more money out of pocket for the patient. It exposes the patient to ionizing radiation and can result in labeling patients with conditions that are not really clinically meaningful, like arthritis, and giving them some false sense of being vulnerable or fragile, when the truth is, they're usually just normal. The ACA goes on to recommend against repeated imaging to monitor a patient's progress. They say that currently there is no information available to support a relationship between changes in alignment or other structural characteristics in patient improvement. Again, repeated X-rays raise the cost of care for the patient. They expose the patient again to unnecessary radiation and may distract from more meaningful outcomes. Not to mention, there are no known connections between performing routine or repeated X-rays to monitor a patient's condition and an improved clinical outcome or meaningful changes in that patient's management. It doesn't matter if you take repeated X-rays. The patients, they turn out the same as they're going to turn out regardless. They go on to say that we should only need repeated X-rays if there is some distinct change in the condition, the symptoms, or something worsening or something of that nature. Otherwise, repeated X-rays, they're just not on the menu. With all of that said, put yourself in the shoes of a chiropractor for just a sec. If you had a new patient that came in hurting and they wanted you to like pop some bones and move some things around, but you really don't know anything about them or what they have previously put themselves through, how comfortable would you be going in blindly with no X-rays? Some chiropractors are very comfortable in doing so. Some chiropractors are not comfortable at all with this scenario. And then of course you have some right in the middle. I have a hard time finding fault in chiropractors choosing to have X-rays on a lot of their patients the first time they come in. right? Just the first time. Your doctor needs to be comfortable and they need to be confident in their treatment. At my office, I personally require x-rays only when there are significant red flags. And the most common red flag that we see is traumatic onset. If a person had a fall, bumped their head, or if they were in a car wreck, those are the very definition of traumatic onset. And I'm going to want x-rays in cases like that, for sure. Other red flags might include history of cancer, night pain, fevers, unexplained weight loss, corticosteroid use, failure to respond to your care after about 4 weeks or so, or progressive loss in neurological function. Those are reasons that maybe you want to get some more information and dive a little bit deeper, and we want to make sure we do our due diligence. Outside of issues like those, though, I don't typically require x-rays to come see me here at my office. In fact, I don't even have an x-ray machine. We send all of our x-rays out because I end up maybe requiring x-rays on 10% of new patients. So there's just no need for us to have one here. We don't get them very often. There is even recent research that hypothesizes that repeated x-rays may be the cause of neurodegenerative diseases. My opinion is this, and it's very simple. If there's no research to back up the use of repeated x-rays or requiring x-rays outside of red flags, well then why not, let's just be on the safe side and not take them at all if we don't need to. If there's no red flags, there's no need for x-rays, for me personally. Now, some of this comes down to common sense. For example, if you're young, you've had no accidents, no trauma, and no health issues, and you wake up one day with a sore neck, do you think you need x-rays if you go to the chiropractor? I mean, inside, in your gut, do you feel like you need x-rays? Well, I'm here to tell you that the research and more current guidelines say you probably don't need them, okay? Now, with that being said, again, every chiropractor is different, and you have to go where you're comfortable going, and you have to do their process because that's what they're comfortable with. Again, I'm not against people doing x-rays on most new patients in the right context, but just arbitrarily shooting them on anybody and everybody who first walks through the door, yeah, I'm not necessarily on board with that. We certainly don't do that. We follow red flags and we follow guidelines. We try to do it the right way, the smart way, the way that is patient-centered and puts our patients at the top of the pile and puts our clinic somewhere down here. And that's the way we do it at Creekstone Integrated Care. Again, this is Dr. Jeff Williams. I hope you're enjoying these weekly videos, and hopefully you're getting a lot of good information out of it. If you're watching us on YouTube, please feel free to hit the subscribe button so that you don't miss any of the ones we have coming up in the future. If you're viewing this on Facebook, hey, share us with somebody. I promise if you find it interesting, one of your friends or family members, they're going to find it interesting as well. Again, I'm Dr. Jeff Williams of Creekstone Integrated Care. Until next week.